Lara Wong, I think, needs no introduction, founder of Clinically Vulnerable Families. Over to you, Lara. Thank you. 5 minutes.
Thank you, Sally. Sorry, I'm just starting my timer, so I'll keep an eye on it myself. Yeah, so lovely to see you all here today. I very much appreciate being invited to speak on behalf of clinically vulnerable families. Um, we were founded in 2020 by myself during the height of the pandemic, particularly focused initially on unsafe schools and the issues that our families faced when we were told that all children had to return to school. Regardless of their health conditions, regardless of the risks in their households. And so sort of since then, our role has kind of grown and our situation has essentially sort of gotten worse as we were forgotten over time. Our needs and things have not been addressed. Access to healthcare, access to, safe access to workplaces, education, are all serious issues that our families continue to face to this day. And I really think that sort of inequalities faced by clinically vulnerable people have not been addressed. And as previous speakers have explained, it is a real and new issue that always existed, actually. I say new, it's not new. It was always a problem for clinically vulnerable people, but we didn't know that we were clinically vulnerable until we were branded with this new name at the start of the pandemic. So we do need our new needs to be considered. We are actually quite a large group. In terms of those who qualify as clinically vulnerable, qualifying for COVID vaccines, that's how we're defined. We didn't define ourselves, we didn't choose our name. It's a third of the population, so it's quite large, and it impacts on the households that those people live in. So I would say that pretty much everyone is part of a clinically vulnerable family, whether they live in a household that's clinically vulnerable or not. Everybody has somebody who's older in their life that they care for. So it's something that we should all care about. Our perspective is very much, when it's safe enough for the most vulnerable, it's safe enough for everyone. And that's what we want to kind of drive for. And so our work in the COVID inquiry, which we were fortunate enough to sort of be involved with, it's really driving forward that sort of view and making people hopefully understand that clinically vulnerable people have these specific needs that must be addressed. And these inequalities are growing, the experiences that we are facing. And thankfully, I mean, as part of that, we did manage to, you may have seen, speak to Professor Chris Whitty on Thursday. And we asked him a question regarding sort of safe ventilation in public buildings. And he said that we should take the ventilation of public buildings much more seriously. It's really key that this is on the record. He is supporting this. He thinks that ventilation is vital. We need to address it. We fully agree with him, obviously, and I'm sure that everyone in this meeting would also agree. Ventilation standards have always been insufficient in this country. They do need upgrading, particularly in light of transmission from this new airborne risk. But also, there are other challenges as well. We've got pollution, children dying from mold, all sorts of other pathogens that pass through the air that can be reduced through air filtration or improved ventilation or both. And it's something that we really would like to see addressed. I'm just going to quickly, if I can, share a slide. And I'm going to try to click on share. Hopefully someone allows me. I'll just talk about it as it stands. So we very much believe that clinical vulnerability is an equality issue. I've done some research. 98% of clinically vulnerable people feel that healthcare is unsafe. 82% of clinically vulnerable households have lost work or retired early due to high household risks. 65% of mask wearers, this isn't just clinically vulnerable people, have experienced mask abuse. And that number seems to be growing over time because people don't understand this new need. And 1 in 5 of our clinically vulnerable families had to withdraw children from unsafe schools, and that was in September 2020. We got that 2022, sorry. But many of our households, 50% of our households, were threatened with fines and prosecutions and told that they had to send their children to school. So many of them were forced to do so in unsafe circumstances. As Sally mentioned, there's this New York City had a proposed mask ban. and also we have faced people in protests being told that they must not mask. Schools, children are being told that they have to attend school whilst sick, and that particularly poses a risk to our families. It's incredibly difficult for us these days, and until these issues are addressed, we are going to continue to face these challenges. So I invite you to support us because we are doing our best to support everyone here. Thank you very much.